Okay, I think we're going now. Okay, hi everybody, Nurse Kristen coming back at you. I'm gonna try to look at the camera instead of down at myself. Um, so I'm back. It's been a few weeks. A little bit of an update. I decided that I would not take that contract. I was offered the contract, but I didn't sign anything. Um, got cold feet again, and just decided not to take the contract. So I'm still working my regular home health job. Um, so I thought, in lieu of, because I was going to show you how it was to be a travel nurse and show you my travel nurse apartment and show you just different aspects of being a travel nurse. But since I'm not doing that anymore, I thought I would try a new thing. So I'm going to try to implement a new series on my channel called Home Health Bootcamp. And we're going to start out with the first video, and I got notes here, so I took down some notes. So the first video is going to be the key players in the home health nursing world, or the home health world. So the key players in the office as well as the key players out in the field. I thought that would be a good topic to start off with. So this is the first one. Who are the key players in a home health agency? Okay. So the first one is the administrator, of course. We're going to start with the office staff. So the first person is the administrator. So this is the person that is responsible for the day-to-day operations of the agency. Typically, the person is not a clinician or a nurse, but the administrator can be a nurse. I have met administrators that were RNs, that were therapists or whatnot, but generally they're really not a clinician per se. They're more of the business end. They deal with the numbers, they deal with the budgets, they deal with that type of thing. So again, they're responsible for the day-to-day, daily operations of the agency. So number 2 is the director of nursing, DON for short, and the name pretty much explains it all. The director of nursing is responsible for the nurses, and really a lot of agencies now use what's called, the title is called Director of Clinical Services, which is probably a better title because it not only encompasses the nurses, but it encompasses all the clinicians out in the field, not just the nurses. So the DON or the Director of Clinical Services, they're kind of interchangeable, but basically they're over, the clinicians out in the field. Just making sure that their documentation is correct, making sure that they're getting their documentation in on time. They might have to do deal a little bit with scheduling, even though there usually is a scheduler in there, which I'll go over her role later, but there usually is a scheduler in the office. They kind of do a little bit of everything. Oh, of course, they're going to do a little bit of HR, a little bit of human resources, hiring, firing people, making sure that the field staff maintain their competencies, things like that. When state comes in and they have to go out with clinicians, they kind of coordinate that, making sure everything is just up to date, especially if you're a Medicare certified agency, which the vast majority of home health agencies are Medicare certified. So just making sure we're staying in compliance with Medicare regulations. So that's what a DON does. Clinical supervisor is a person that is kind of like the liaison between the field staff and the director of nursing. So the clinical supervisor handles like the daily calls from the field staff. They're the ones that, when the clinicians call in, start a care report for when they do an admission or do a resumption of care or a recert. They call in their report to the clinical supervisor. They call in their frequencies to the clinical supervisor. If there's an issue with patient care, usually the clinical supervisor deals with that as well. Calling doctors, even though the field staff calls doctors too, but they also do call the doctors. They will sometimes have to, what's the word? Nicely bug or nicely ask persistently for signatures for the 485, which is a plan of care, that type of thing. So clinical supervisors do a lot. Then you have your intake department, and the intake department is basically, I got something on my computer, distracted me. So, anyways, the intake department is the department that receives the referrals from whatever the referral source is. So, usually they have like a little database of referral sources, and when a referral does come in, they'll check insurance and make sure that the patient is able to be seen by an RN, and then they'll forward it to the scheduling department to schedule the patient to the RN. So they get the referral, they check insurance, they check demographics, they may call the patient and let the patient know, hey, a nurse is going to be calling you. For home health, we got a referral from the hospital or the doctor's office or the skilled nursing facility for you to receive home health services. I'm just making sure that your name and your address is correct. Again, they check insurance, and then they pass it on to scheduling to be scheduled out to an RN or PT or whoever it is. Okay, so that's intake. So then you have your marketers. And a marketer is basically they're used to be called marketers, but now I think they're called more so like patient liaisons. I guess it just sounds better. But basically, they're kind of the bridge between the agency and the referral source. So they develop relationships out in the community with doctors' offices, with skilled nursing facilities, with hospitals, and hopefully, based on those relationships that they develop, those providers will refer their patients to the agency to be taken care of by the clinicians. So again, they're called marketers. Sometimes they're called liaisons. I believe they do receive I think they have a base salary plus a commission for, how many referrals they can bring in every month, something to that effect. I'm not too clear on it. That's really not my I don't really deal with the marketers that much, to be honest, but that is a basic gist of what they do. They are responsible for bringing in business or referrals to the agency, basically. So that's marketers. And then you have your schedulers. Again, I kind of touched on that earlier. So a scheduler, once they receive the referral from the intake department, they will schedule the patient out to usually it's the RN, for the admission, so that the RN can admit the patient to the agency. Also, schedulers also schedule out visits, like routine visits. So once the patient's been started, then the patient has to be followed by a clinician. So they will schedule follow-up visits or routine visits to field staff as well. They also schedule for therapy, not just nursing. They schedule for everyone. So they have a big job. So that's scheduling. So that's the office part of the home health company. You have the administrator, the DON or director of clinical services. You have the clinical supervisor. You have intake. You have the marketer, and you have the scheduler. So now let's transition to field staff. So usually the leader of the field staff is the registered nurse. So what does the registered nurse do? We usually admit the patient to home health services. We also will do any type of OASIS. So the OASIS is the basic assessment tool that clinicians use for Medicare, especially for Medicare patients. It can be used for other insurance, but definitely for Medicare, to gather information, a comprehensive assessment, so that the patient can be started on home health services. So you have the OASIS start of care. You also have an OASIS resumption of care. That's after the patient has been hospitalized and then comes back out into the community. We resume the patient. So they've already been started, but they had to go to the hospital for some reason, and then they just come out of the hospital, and we're doing a resumption to resume their services on home health. Then you have a recertification that RNs only usually do, and that's recertifying the patient after a 60-day period. The certification period is 60 days. So if the patient needs care beyond the 60 days, the patient has to be recertified. And RNs do that too. And then also RNs do the discharge. So when the patient's ready, they've met all their goals, and they're ready to be discharged, the RN does that too. Now, I say the RN because we mainly do those, but also physical therapists can do OASIS visits as well. They can start patients, they can resume. Well, I don't know about resume, but I know they can start and they can discharge. And I believe they can research as well, so they probably can resume. So that's mainly what the RNs do. We can also do follow-up visits, routine visits as well, wound cares and IVs and whatever else. Um, but yeah, so we kind of coordinate care. Um, if we see a patient, say we're going to, to see a patient for, I don't know, wound care, but we see that the patient, and that's the only thing we're providing, but we see the patient is like using a walker, or maybe that's a bad example, but say the patient is kind of walking with an altered gait, or if a patient says they recently had a fall, well, then you're going to want to call the doctor's office and get a referral for a PT eval because the patient needs to be evaluated for physical therapy. They've had a recent fall, they have an altered gait, they have an altered balance. Anything like that, they really should be getting looked at by PT. So that's just a little bit of what an RN does. RNs also do a lot more than that, but that's just a good description, a good roundabout description of what we do. Then you have your LPN, of course. LPNs do routine follow-up nursing visits. They don't do any OASIS, they don't do starts, they don't do research, they don't do resumptions, and they don't discharge from the agency. I don't even believe they can do a discipline discharge either. So basically what they do is they do routine visits only, and they have to be predictable type visits, and the patients have to be stable. So they can do wound care. If they're IV certified, they can do IVs. They can do wound vacs, that type of thing. But again, the patients have to be stable, and the outcomes have to be predictable. And of course, they're the eyes and ears of the nurse, of the RN. So if they see any changes from baseline, of course, they need to report that to the RN. So that's basically what the LPNs do. And then, like I said, I kind of give you a roundabout of what PTs do. But yes, you have your physical therapists, and they're mainly concerned with balance, gait, safety, mobility, that type of thing. And then you have your occupational therapists, and they're mainly concerned with safety of the patients performing their activities of daily living, or their ADLs. So they're grooming, they're bathing, they're dressing, eating, holding a fork, that type of thing. That's more of their area of expertise. And then you have speech therapy. So speech therapy obviously is indicated for patients that have maybe had a stroke and they have dysphagia, which is difficulty swallowing. So you would definitely need speech therapy for that. Speech therapy also does speech, obviously. They help with the speech, they help with swallowing, and they also help with cognition. So a lot of your dementia patients, cognitively impaired patients, ST actually does help with cognition. A lot of people do not know that. Then you have your medical social worker, or MSW. So the social worker is a good resource for patients, for example, that live alone, that have a limited social network, that type of thing. Patients that have limited resources, limited transportation, limited means. If you see that, then a social worker would definitely be indicated. And then you have your home health aide, or HHA. So the home health aide is really utilized by Medicare for patients that um, have decreased mobility for a short-term time, for a short-term period, say for only a couple weeks or so. And so the home health aide would come out 2 to 3 times a week. Usually they're only hour-long visits, and they'll perform personal care like a bath and getting them dressed, just to get them over that hump between discharge from the hospital and them going back to their daily routine. So a lot of your surgery patients will have a home health aide to kind of help them during the recovery period. It's temporary and it's very short term, and like I said, they're only hour-long visits. Some agencies will utilize a psych nurse, because we do have, mental health is a big thing in this country. So some agencies will utilize a psych nurse to help patients that have multiple psychiatric diagnoses or patients that are on a lot of psychiatric meds. And that is basically the gist. So to go over the field staff again, you have your RN, you have your LPN, you have your physical therapist, you have your occupational therapist, you have your speech therapist, and they're also called speech language pathologists. You also have your medical social worker or MSW, and you also have your home health aide or HHA, and sometimes you will have a psych nurse as well. And so, in a nutshell, that is the key members of the home health team. And then, of course, at the center of it all is the patient. So, that concludes video number 1 of the Home Health Bootcamp series. If you have any questions or comments regarding my video, you can leave it down below. Otherwise, I will see you later. Thanks. Bye.